back again. I just wanted to give you a bit more background on me and my family before we get into the nitty-gritty. So I keep forgetting that whoever's watching, friends, family would know. No one else would though. But we used to live in South Africa, moved to New Zealand 2019, lived there for 5 years, and last year moved to Australia. Absolutely love New Zealand, beautiful, stunning, culture's amazing. But we just decided to come to Australia, be close to family, and just have a different lifestyle as well, you know. In saying that, we've got 2 girls, 11 and 7. Light of our lives, absolutely love them to bits and pieces. They go to the same school. Evelyn is in her last year of primary school, which is shocking. I can't believe how quickly time has gone. And Dakota is in year 2. They have got great teachers this year as well, which is phenomenal. And obviously with me working from home, I get to fetch them and drop them and be around for them as well. So that's really, really good, especially with having to deal with what we're currently going through. We've managed to find some good friends here that have also, we've told them about my diagnosis. So they have been so great, so grateful to have them around. They've been great with the girls and asking if they need to drop them at school or fetch them or whatever the deal is. So that's great as well. We live in Kellyville, which is quite far from Sydney CBD. It's about 40 odd minutes or so. And live in a nice area. It's quite similar to, for South Africans, quite similar to where we used to live in Alberton. Very similar as well to like Auckland, but Auckland's more beach life, where here it's more residential life, more city. So my last video, I just chatted to you guys about finding out about my breast cancer, finding it, being diagnosed. There's so many like technical terms that they give you when you go see the doctor or the breast specialist or the oncologist or your normal GP or whatever, and you know, you get lost in the details, and sometimes Google is not your friend. I've stopped Googling everything. I refuse to now. I will Google words of the medication that I would need to be on, or I'd Google what they doing to me or the procedure that's going to be done. I'll Google that, but nothing further than that, because you just start going down this horrible, horrible rabbit hole of it's going to metastasize, it's going to have spread, you're going to die, you're going to... These are horrible, unnecessary anxieties on top of this major anxiety already that you've been diagnosed with cancer. You have got it. You are young, you are fit, you are healthy, but you still have breast cancer. It's not like it's the flu. It's not like it's just going to go away. It's something that has to be worked on, and it's something that, you know, affects not only me, but my family, and not only my close family, but friends and family, because obviously everyone goes through cancer differently. You know, I'm not, it's not new to me. My mom was diagnosed with breast cancer when I was very young, and she unfortunately had to have a mastectomy. And so, you know, we were around radiation and chemo treatment and all of that. She only had radiation actually at that time, so she didn't have the hair loss and feeling sick and all of that. And then unfortunately, my dad was diagnosed with lung cancer in 2020, early January, and unfortunately he passed away from it because it had just spread too much. I don't think that it was caught early enough. That's a whole other story. That's not about me or anyone else. But so my dad had that, and they were going to start him on chemo, and he was going to be all good in 6 months, but obviously that didn't happen. I was also told that my aunt had breast cancer, and here we are. That's what I was diagnosed with at the beginning of 2025. After seeing the breast specialist after my diagnosis, she said she would like me to go for an MRI and a PET scan, which she asked if I could possibly squeeze those appointments in that same week that I saw her. She said maybe you won't be able to, but it would be great because every Friday, her and a whole bunch of oncologists and other breast specialists, they get together every Friday and they discuss their patients. They discuss their markers, their cancer markers. They discuss all of that, and then it's not just her that decides what your treatment is. It's a whole bunch of them come together, which is great because then it's like, they're saying more heads the better. So it's like they all come together and they all discuss the way forward per patient. So for me, she really wanted to get on top of it because it's early enough to catch it. I'm young, fit, healthy, so she wanted to do all that. So I went into the MRI. I didn't know what to expect. It's not so bad. They obviously put you in this machine. It's the weirdest thing in the world because not only are you completely naked, you would assume that an MRI, you're going to lay on your back and go through this machine, and it scans you, and then they also inject you with a chemical that gives them better imaging of your body inside. But no, not us poor women that have to have our breasts scanned. No. You have to literally lay on your stomach in this open cavity that your poor boobs have to hang in. Like already, being a mother, you got droopy boobs. Now you must have them hang even more. Anyway, I was embarrassed more for the poor nurses. They have to try and maneuver you and pull your boob up this way and that way. And anyway, it was quite funny, but obviously it's scary. But fine, there's nothing to it. Obviously, the test is not scary. It's not knowing the result that is scary. Same as having that MRI done, having spoken to the nurse that did my drip before going in. She was amazing. Absolutely put your mind at ease, put me at ease, everything, Go and have the MRI. It's really loud, so they put noise-cancelling headphones on you and play music. And it's quick, maybe 15-20 minutes. Pass in the machine about 3 or 4 times. Then the last time that you're going to go in, they say to you, now we're going to activate the chemical. You feel this freezing cold sensation from where the drip is. It's freezing cold sensation going up your arm, down into your chest, almost like this wash of cold going through your body as the chemical is being put into your veins. Do a quick pass over of that. When they finish, they pull you out, you get back dressed, and you go. And then it's absolutely amazing because my doctor already had my results an hour after I had finished that MRI. Had to go for a PET scan. MRI was another panic as well because of all my piercings. You have to take out all of your jewelry, and I was so worried that I'd forgotten one or didn't get it out or whatever because it's big metals, basically magnets. That was all good. Then on the Friday, I did the PET scan, which that one was a bit more taxing on me mentally. You get there, you obviously sign in, do all your paperwork, and then they inject you with radioactive glucose. And then what happens is that radioactive glucose shows up as light spots, like flashes, wherever there is a lesion or cancer or something abnormal, it would shine bright, like it literally lights up on the scan throughout your whole body. But because places like your brain and I think it's your bladder and your kidney, because they naturally take sugar from your body to process the sugar, because your brain needs sugar, needs glucose, your brain and your kidney and stuff like that already are, they already light up naturally because there's more sugars there. However, what happens is that with cancer eats sugar or eats the glucose. It needs the glucose to survive and multiply. So obviously those areas where the cancer would be, like a breast, would light up, and that's not a normal place for glucose to show up. So it wouldn't be a normal place that the radiation glucose would naturally go to or flare to. It would generally go to your brain or through your digestive tract out through your urine. So that was a scary test, but obviously in the back of your mind it's going, you're like, I hope that this doesn't reflect any other place. Like, I hope it hasn't moved, I hope it hasn't spread, I hope it hasn't done this, I hope it hasn't done that. And obviously that's where your concerns always go. So once that was done, I had to wait for my results. And that test was a bit more taxing, as I said, because you get there and you get a wonderful nurse. She injects you with radioactive glucose. You have to wait a full hour for that to work through your body before they do the test or the scans. So that's an hour of sitting in a dark room, not being on your phone, none of that, just kind of relaxing. And I think that's where the most taxing it was on me and my mental state, because being in that dark room and nothing else to do except think, reflect, question, surmise, like everything, like you're just freaking out because you're like sitting in that dark room and you're like, it's spread. Where is it spread to? Is it in my lungs? Is it in my bones? Is it in my heart? Is it in my stomach? Is it? All these questions just keep rising and rising and rising and rising. And you think to yourself, like, why? Like, I never questioned why me. I just feel that it's happened, and all I can actually do now is deal with it. I can't, me physically myself, do anything about it except be positive, carry on as normal, be there for my kids, my husband, and just live life like I'm going to be here next week. I'm going to be here in a year's time, because there's no reason for me not to be. And once you've done that test, your results get sent back to the specialist, to my breast specialist, and she gave me a call and she said to me, right, I've got your tests. I've already discussed you at the meeting, because this was on the Friday morning. I did the PET scan already on the Friday afternoon. She phoned and said, I've got your results, everything. I've had our meeting, we've discussed you, and the way forward for you is chemo. I've set up a meeting with the oncologist. The oncologist will phone you and go down that path, and she will then explain to you what the next steps are. But she also wanted me to go for a biopsy of one lymph node under the right arm in the level 1 lower axillary, because it was slightly thickened, so it was abnormal. But on the MRI, it showed slightly thickened, but on the PET scan, it never showed up. So it was strange, because it showed up on one scan but not on the other. Anyway, I went and had that biopsy of that lymph node, and then at the same time, they put something into the areas of concern or the lesions, they put these little metal, like tiny, absolutely tiny little things called clips. It's like a little metal ring. And what that is for is that when you're finished your chemo kills everything, good and bad cells. But your good cells reproduce quicker than the bad cells do. So the cancer cells will be killed, everything will be killed. So when they do the operation or my surgery to possibly remove it, they can then find it with having those little metal clips in, because it won't show up on any scans. Because the cancer is dead, it won't light up. So they use those little metal clips to then find the lymph node that was abnormal and to find the cancer in my breast. And if there were any other areas of concerns, they would also then have highlighted those or biopsied those or put little clips in those. So everything else is fine. There's a little lump on my thyroid, but she said she's not worried about it now. She'll tackle that down the line, because 9 out of 10, whatever it is going to get killed by the chemo anyway. So that was all that. And then just had to wait patiently for the oncologist to give me a call and let me know what's the next step from them. So that was also a bit of a tense wait, because that whole next week I didn't hear from the oncologist, not once. The following week, Friday, the oncologist phoned me and set up a meeting, an appointment to come see her to discuss what treatment for me looks like. And so that was last week Thursday, being the, I don't know, the 7th, I think, 6th of Feb. So having had that meeting with her, after that, going through all of the motions of the chemo and that, and what's next. But I'll discuss that a bit in more depth in my next video. Thanks so much for listening to me ramble. If at any point you want me to reiterate or explain anything in depth, please just shout out.